Hello, and thank you for listening to today's episode of JATCast, the official podcast of the Journal of Athletic Training. I'm your host, Luke Donovan. This month, we will review 2 articles over 2 short episodes from the upcoming issue of the Journal of Athletic Training. The overall goals of the 2 episodes are to present information about the King-Devick test as part of baseline concussion assessment and also the reliability of the test. For the first episode, I will summarize the article titled Relationship Between the King-Devick Test and Commonly Used Concussion Tests at Baseline by Dr. James R. Clugston and colleagues. For the second episode, I will discuss the reliability of the King-Devick test between trials and over the course of a year in collegiate athletes. As a reminder, the article discussed today can be found on the JAT website, natajournals.org. And please remember that all content from JAT is open access to all readers thanks to the funding from the National Athletic Trainers Association. Let's survey the scene. Within the United States, upwards of 3.8 million sport-related concussions occur annually. Commonly reported clinical concussion symptoms are dizziness and headaches, which manifest as impaired balance, cognition, and vestibular function. Due to the multifaceted impairments associated with the injury, evaluation protocols include numerous tests to quantify deficits across multiple systems. Presently, the National Collegiate Athletic Association recommends that all student athletes perform baseline concussion assessments containing 1. Previous concussion and brain injury history, 2. Concussion-related symptom evaluation, 3. Cognitive assessment, and 4. Balance evaluation. This baseline testing can be used to establish individualized patient care, track patient progress, and identify specific impairments in the event of a concussion. Some institutions may include additional tests to further characterize the injury. Over the past decade, a multitude of tests and evaluation tools have been created to assess specific domains related to concussions. Although these tools are designed to help facilitate clinicians' ability to diagnose and treat patients with concussions, the large quantity of tools may burden the clinician on choosing the most appropriate combinations to maximize the comprehensive examination. Aside from being valid and responsive to the change, concussion evaluation tools should provide unique information regarding the injury and to not be redundant with other instruments. One specific assessment domain that is increasingly become incorporated into baseline concussion assessments is visual-based measures to capture oculomotor function. The King-Devick test is one such test that evaluates various aspects of oculomotor function, such as smooth pursuit, saccadic eye movements, and convergence. The King-Devick test is a time horizontal saccadic eye movement test that requires individuals to quickly read numbers aloud from either spiral-bound paper test cards or an electronic tablet application. Although performance on the test relies on the oculomotor function, other aspects such as attention, concentration, reaction time, and processing speed may contribute to test results, and therefore, these domains may overlap with performance domains measured using other common examination tools. As such, the purpose of this study was to determine whether relationships exist between performance on the King-Devick test and other commonly used assessment tools in collegiate athletes. Participants were non-injured student athletes, cadets, and midshipmen from 29 universities. At baseline, individuals who enrolled in the study completed the King-Devick test, a system checklist, the brief symptom inventory 18 to measure psychological distress, the balance error scoring system, the standardized assessment of concussion, also known as the SAC, the immediate post-concussion assessment and cognitive testing, known as the impact test, and the vestibular oculomotor screening. Each exam corresponded to its own exclusion criteria, and therefore not all tests had the same number of participants. However, most tests had around 2,000 individuals. The primary results of the study are that scores from the SAC concentration, impact visual motor speed, and impact reaction time were weakly related to the King-Devick test. There was no relationship between the King-Devick test and other baseline assessment tools included in the study. The evaluation tools that were found to have a weak relationship only explain 16.8% of the variance of the King-Devick test time, which then translates to meaning 83.2% of the variance in the King-Devick test is being explained by factors not captured by the other assessment tools, meaning the King-Devick test provides unique information. Another finding to highlight from the study is the lack of relationship between the King-Devick test and the vestibular oculomotor screening. as both of these tests are described as time saccadic eye movement tests. However, when looking at the procedures of each test, there are some differences that may then elucidate these lack of relationship between the two different tests. In summary, the King-Devick test has little overlap with other common baseline concussion tools and may contribute to a more comprehensive assessment of concussions. Future investigations should evaluate relationships between assessment tools and injured athletes, as well as establish the reliability of the King-Devick test over multiple time frames. Well, that's it for today's JATcast. Please remember to rate and subscribe to the podcast, which is available on iTunes, Google Play, Spotify, YouTube, and Stitcher. You can find out more information about upcoming podcasts and other JAT events on our Twitter, Facebook, and Instagram accounts at JAT_NATA. Thank you for listening and keep a lookout for next episode of JATcast.